My name is Michael Carey Brooks. I am the CEO of Leo Health Services. We are a healthcare navigation service for all law enforcement nationwide. Our goal is to connect heroes to heroes. We also are a physician membership organization, and it's those physicians who are willing to help us understand the best opportunities for our law enforcement personnel to receive the best possible care.
It is funded by the members that join and dedicate and take an oath to helping to support law enforcement.
9 years ago, I was hired to help the state troopers with a group of doctors that they had. I was able to bring some medical background into it to understand different medical specialties and what was needed for people to actually access care in a timely, efficient way. And we took that concept and we built relationships with every major hospital in the state of New York and some outside the state. And what we found was people were accessing care much more efficiently and they end up getting better outcomes.
We learned during COVID about the complexities of the healthcare system, and certainly law enforcement officers have extra stressors and struggles getting to the right treatment. And Leo Health Services has navigators and other folks who help law enforcement officers get to the right doctors and get the right out of their treatment so that they get really good health care.
I'm Daniel Rayo, the CEO of HouseMD. Our mission overall is to solve the healthcare crisis in this country. We do so by merging and bridging innovative health technologies with humanity. We are able to take data and platforms with our great physicians, nurse practitioners, PAs, and nurses to extend healthcare out to all corners of the tri-state area. Michael Brooks is a down-to-earth, passionate, spirited human being. He cares about what he does, and that's what's drawn me to Leo Health and this strategic partnership. And I believe the same holds true on their side.
It's very rare that you can meet people that you know pretty much right off the bat that not only are they a good person, they have good work ethic, but that you are going to do something with them. And it was amazing that Daniel felt the same way about us. And it's been a very easy partnership on so many different levels.
We need people like HouseMD because they are also trying to make sure that people have access when they need it. And I think the two types of entities work so well together to meet that goal and to really change the way people interface medicine. Thank you all for being here. I sincerely appreciate it. What we're going to do today is kind of put ourselves in the shoes of a law enforcement officer for a minute. This is an opportunity to not think about, can I shoot? It's to think about, should I have shot? That's what law enforcement officers deal with all the time.
Today's event was a great opportunity to see doctors talk to law enforcement officers and doctors really experience what it's like to be a law enforcement officer.
Officers have a very tough job. They are under a tremendous amount of stress where they're exposed to very tough imagery all day long. And over time, it literally changes you as a human being.
It really doesn't matter how you feel about law enforcement. They're people first. So getting to see what they deal with on a regular basis helps bridge that gap.
You come off those sites for any reason, we bring it into your home position. Your finger will remain straight and off that trigger feeling to steal that gun. Understood? Understood.
We're proud to be here with Leo Health. Their organization does what we believe, which is bridging the divide between healthcare services and the people that need it most. In their case, they're dealing with law enforcement agencies across this great nation. It is truly the fabric of who we are, which is to show empathy and to provide empathic care to all of our patients, but specific to today's event, to these law enforcement individuals that deserve it so much.
We are looking to do other events showcasing not only the doctors that helped, but the law enforcement that were affected by it. And we're hoping that these events are really fun reasons that people can come together.
As Leo Health Services expands into other states, it may provide HouseMD an opportunity to do the same. We're growing and we're trying to have that impact nationwide. And I'm sure we're only going to learn together and continue to be there for people when they need us.
What the future holds is a truly integrated process with our platform, our technologies, and humanity and people, our patients, our clients, and our providers. And that's what I believe. If we maintain our focus on that innovation, we will do what our mission is set out to do, which is solving the healthcare crisis in this country.